Hi, this is Dr. Girish AC, consultant plastic and cosmetic surgeon. I am heading Curls and Curves Cosmetic Surgery Center, Vijayanagar, Bangalore. The hair transplantation is a cosmetic procedure which treats in the late stages of the hair loss. In the early stage of hair loss, that is in the early thinning or a mild thinning, at that stage, usually the medicines are prescribed. Minoxidil or multivitamins are prescribed. So in the next stage of the thinning, we usually advise PRP, that is platelet rich plasma, or the GFC, that is growth factor concentrate. So with this combination, the hair loss can be postponed or controlled. In the later stage of hair loss, that is severe thinning or baldness, so which can happen in case of both male and females, the hair transplant will help at this stage, not in the early stage of hair loss. Donor area is usually at the back, so we remove the hair along with the root through FUE technique. So this is transferred to the recipient area wherever it is required. So this is a daycare surgery done under local anesthesia. There are two methods in hair transplantation. One is FUT and another one is FUE. FUT is a follicular unit transfer and the another one is FUE, that is follicular unit extraction. In FUT, the strip is excised from the back and it is livered, the individual graft separated, then transferred. So there will be one line scar at the back. Whereas in FUE, individual grafts are harvested from the back using very fine punches. So we usually use around 0.8 or 0.9 mm punches. On the day of surgery, usually when they come in the morning after having some breakfast, we usually take a photographs as it is. Then we mark the area. We discuss like how many grafts to be transferred. Then we do a zero trimming. Once again, photos are taken, marking is redone, it is shown, confirmed, and under local anesthesia at the back, we harvest the graft, so which takes around 3 hours. After that, once again, one food break is given. So after that, we give once again local anesthesia to the forehead and we make slits in the recipient area when grafts are transferred. The overall procedure roughly takes around 6 to 8 hours. The whole procedure is pain-free except when we are giving local anesthesia. That is usually around 5 to 10 minutes time. Even that is minimized using the very fine needle and the vibrators. So these things will also reduce that minimal pain. After the procedure, the dressing is done, headband is given. They need to stay at home for next 1 week because of the dressing at the back. Only care is just a minimal care. They need to apply some ointment to the grafted area. We prescribe the antibiotics and painkillers to control and to avoid the infection.